Hi there, it's Kathy Cates and Melissa Hines from the Institute for Pelvic Health.
And you're watching Demystifying the Pelvic Floor, weekly videos providing real and simplified pelvic floor education for your real clinical situations. We've got you covered.
And today we're going to go over postural assessment and some quick documentation tips with a handy handout that we've created for you guys. So I think you guys would be shocked at knowing how important pelvic alignment is for any sort of pelvic floor dysfunction. So we've created this handout for you guys of things to look for when you are looking at pelvic alignment and just overall postural assessment, because it will tell you a good amount about what's going on with your patient when it comes to their pelvic pain or any pelvic floor dysfunction.
And a lot of this you can do as they're walking into the room, right? Like you can look at the way where their head is in relationship to their spine. You can look to see if they have a forward head. Even when you open the door to the exam room and you see them sitting there, start noticing right away. Look at the shoulders. Are the shoulders rounded? Even in sitting, you can see kyphosis.
Yeah, so they don't need to be like standing in front of you. It is helpful to look at those very like pinpointed areas, like if they have a right pelvic upslip or compression on one side of their body. That's much easier to see if they're standing right in front of you. But like Kathy said, you can find a lot of this dysfunction just by them walking through the door and how they're carrying themselves. So the main ones that we look for, besides the forward head, rounded shoulders, thoracic kyphosis, lumbar lordosis, or flat lumbar curve, or gluteal squeeze, we look a lot at the iliac crest. So Kathy, can you show us the iliac crest on your pelvic model?
And so
So the iliac crests are easy to find on your patient because when you're palpating, you'll take your hands and this inner part of your index finger, you'll kind of like karate chop their sides right at their waistline. And you'll be right above that bone. And then you sink your fingers down towards the floor. And then you're kind of hooking right on top of it. And that you'll see if one side is higher than the other. There's potentially compression or an upslip of that high side. And that can throw off the internal pelvic floor muscles because there will be compensatory patterns that start because they're getting tight on one side or overworking on one side because of any imbalance in the body. The pelvis is like, yeah.
Oh, sorry, Melissa. And I think we're so used to thinking that these osseous structures are fixed, right? And I think the whole pelvic girdle, each of these hips, they can go up or down. So I think that's something I know as an NP that I wasn't ever taught that. Like they're not fixed, like that they can go up, they can rotate forward. And so I think when we talk about that upslip and you're looking at the iliac crest, just think about like the hips are almost like wheels and they can move. Not only do they rotate, but they actually can go up and down a little bit.
So once you've palpated the iliac crest for that compression in their side or in their back, that one-sided compression, then you're going to look for rotation of the pelvis. So that would be at the ASIS, or that anterior superior iliac spine that Kathy is palpating. And that is harder to find in standing. And if you have a tough time with it and you want to check for a rotation, because it will signify some hip flexor tightness, some compression in that inguinal area or that groin that could be contributing to their pain or dysfunction, then have them lie down. But you're going to take your thumbs. I first karate chop my hands on the iliac crest, and then I allow my thumbs to just kind of drop down, and that's at a rough point of where the ASIS is. So then you take
and you start to go up, right, Melissa?
Yeah, so you take the thumbs, you sink in, and then you want to hook underneath the ASIS. So you're kind of sinking towards their leg, and then you're hooking up We go over this like in detail in our course, and you can see a close-up of how to palpate this. And you'll get access to this great handout here. But that is really important because it will tell you if they have psoas tightness, hip flexor tightness, and all of that can contribute to pelvic pain. So again, we want to look holistically at the whole pelvic area, not just the internal muscles, because the external muscles tell you what's going on internally.
And this is why this is totally within the wheelhouse of NPs, certified nurse midwives, 100%. You can absolutely identify a pelvic upslip, an anterior rotation, and then once you've done that, we have things that you can offer to your patients that work.
Yeah.
While you're waiting, rather than ordering one more pelvic ultrasound, rather than treating for one more UTI that they don't have, or one more vaginal infection that they don't have, incorporating this in, and it can be done very quickly. And we teach you how to do it, as Melissa said in our course. And the more you practice, it just becomes second nature. You can absolutely do it. It's totally in your wheelhouse, and you can really help your patients so much, because when there's dysfunction externally, there's a lot of compensation going on internally.
And you are assessing shoulder impingement all day long and other musculoskeletal issues. So think of this as like a special test for pelvic floor dysfunction.
Love it, 100%.
And that's a wrap. Did you like this video? If so, hit like and subscribe. Please share with your colleagues and comment below to let us know your biggest challenges with doing a quick postural assessment in your clinical practice.
And subscribe to our email list at instituteforpelvichealth.com to get your free guide, 4 tips for managing your challenging pelvic exam. And you'll get access to our weekly pelvic health content.
And be sure to find us on Instagram, Facebook, and LinkedIn, where we'll post more pelvic health tips. And make sure that you've signed up for our newsletter and email list, where we send out some crucial information, especially about our course launch that is coming within the next couple of weeks.
Woohoo! Our course will break down the pelvic floor so that you can confidently care for your patients with pelvic floor dysfunction. By simplifying the pelvic floor, we'll improve patient outcomes and your provider experience. Thanks for watching and spreading the word. Let's revolutionize pelvic health. We'll see you soon.